Welcome to Module 7 of the Wisconsin MPJE course through the Medical College of Wisconsin School of Pharmacy. This is a snapshot on remote dispensing sites. On this slide, you will find important definitions to know for the exam. A more recent change in the law is that a remote dispensing site is now a licensed pharmacy. A remote dispensing site, or RDS, is now a licensed pharmacy that does not need a pharmacist on the premises. It is important to note that the term remote does not refer to the location of the pharmacy. It is also important to know that the definition of healthcare facility is any hospital, nursing home, community-based residential facility, county home, county infirmary, county hospital, or county mental health center. As previously mentioned, RDS must now be licensed as a pharmacy. Since they are under that category, per Wisconsin law, they must adhere to all regulations that normal operating pharmacies follow, with the exception of pharmacist presence. You can go to Module 2 for a review of the requirements needed to create a licensed pharmacy. While a pharmacist does not need to be on site, they do need to be able to supervise the activities of the pharmacy remotely. The RDS cannot operate if the pharmacist is not available remotely, and medications cannot be dispensed if patients or pharmacy delegates cannot communicate with the supervising pharmacist. Of note, neither laws nor regulations state where the pharmacist is located. It could be another pharmacy or another site. Here is a list of all of the places an RDS can legally operate. In general, the RDS can operate in a health clinic, such as a doctor's office or rehab facility. It can also be a correctional facility, such as a juvenile correction facility or state prison. The RDS can also operate in a residential care facility for children or youth. However, places an RDS cannot operate are places such as a coffee shop, department store, or schools. With the new regulations, a licensed pharmacy can operate as both a regular pharmacy and a remote dispensing site at different times, depending on where the pharmacist is located. Every RDS is required to have a sign posted that states that prescriptions may be filled at this location. Additionally, signage must state that this is a remote dispensing site being supervised by a pharmacist and include the name, address, and phone number of their supervising pharmacy. Notice that the signage must state the pharmacist is employed by that pharmacy, not that they are physically there. As a licensed pharmacy, they must also include all other signage required that can be found in Module 2. RDS need to follow the same requirements of a normal pharmacy, including visual inspection of orders, labels, and products. According to recent updates, the prescription label should include the name and address of the remote dispensing site. The final check must still occur and all federal laws must be followed, such as those for controlled substances. Like a normal pharmacy, a pharmacist must be available for counseling in compliance with FAR 708. This can be done virtually with the pharmacist as needed. As previously stated, the delegate must be able to have communication with the pharmacist in order to dispense prescriptions. A delegate must be one of the following: a registered pharmacy technician, pharmacy student in their P3 or P4 year, pharmacy graduate who has submitted their application for licensure or is awaiting examination, or a reciprocating pharmacist transferring their license from another state. They must also meet the following requirements. They must be 18 years of age or older, have a high school graduate or equivalent, and they must either have 1,500 hours of work as a technician in the 3 years prior to working at the RDS, or have completed accredited training for a technician, such as CPHT. Managing pharmacists also have requirements to assure the RDS is in compliance with all the rules and regulations set forth by the board. They must have written policies for system operation, safety, security, accuracy, and access. They must have quality assurance programs to monitor performance, looking at the number of prescriptions dispensed per month, the number of medication errors documented, loss or diversion, and documentation of remedial training to prevent future errors. They must complete a minimum of monthly visits with documentations of each visit maintained for at least 5 years. This should include confirming the delivery status of all drugs, ensure written policies and procedures are being followed, ensure that remote dispensing site personnel comply with all federal and state laws regulating the practice of pharmacy. Documentation of acceptance, and above responsibilities with signatures and dates by the managing pharmacist should also be kept for 5 years. A managing pharmacist must report to the board if they have more than 5 sites under them, and they are not allowed to have more than 10 sites without the board's approval. Thank you for listening to this snapshot on remote dispensing sites. Please see the companion questions for further practice.